Alrighty, well, good afternoon, everyone, and welcome to this informational webinar on Social Security disability hosted by U.S. Senator Bob Casey's office and the Social Security Administration. We're grateful for everyone taking the time to join this call today. I wanted to start by introducing myself and the other panelists on this call. My name is Andrea Guscott, and I'm one of Senator Bob Casey's constituent advocates. Also on this call from Senator Casey's office is constituent advocate Mackenzie. And then also we are excited to introduce Frank Magny, who is from the Social Security Administration. He is Social Security's public affairs specialist, and we are grateful for his willingness to join our office for today's webinar. Before we get started, I will quickly note that if you have any questions, please hold them until the end of the presentation when we will have a Q&A session. We ask that you please keep your questions general and applicable to as many people as possible since this is a public call. If you have questions regarding your own specific situation, contact information for Senator Casey's office and the Social Security Administration will be provided during the presentation for you to reach out to directly. At this time, I'm going to turn the call over to Frank with Social Security to delve more into the specifics.
Thank you so much, Andrea, and welcome everybody. It's a pleasure to have some time to explain our disability programs today. We have a bit to get to, so I'm not going to delay any longer. If we can get to my first slide, please. All right, and to the next slide, please. Excellent. As of December 2021, Social Security paid an average monthly disability payment of $1,222.45. According to the U.S. Census Bureau, 85.2 million people live in the United States. 27% of the population lived with a disability, and this is disability programs that apply to the Social Security Administration. Of those 55.1 million people, 18% of the population lives with a severe disability. I feel like these statistics in my mind show how this can affect potentially people in your lives that may not be taking advantage of benefits that they might be eligible for. And in that way, I hope maybe I can motivate or encourage individuals to potentially see if there's eligibility. And we're going to talk about the application process and eligibility for disability from the Social Security Administration, because it is slightly different than other disability programs. If we can move on to the next slide, please. Okay, so I'm going to be talking about two different Social Security programs. The first one I'll be talking about here is Social Security Disability Insurance. The other program I'll be talking about is Supplemental Security Income. Part of my presentation is explaining the differences between these two programs. Social Security disability definition requires that you have a medical condition that prevents you from doing substantial work for at least 12 months, or if your condition is terminal. This work determination is based off of age, education, and work experience. Our definition makes clear that this distinction between Social Security disability requirements compared to other disability programs, such as benefits you might get from the Veterans Administration, workman's compensation. There's also other short-term disability programs, AFLAC, which is like private insurance for individuals that might be out of work for a period of time. In addition to meeting the definition of disability, you must also have worked long enough and recent enough to qualify, and that's something I'll speak about a little bit more. The number of work credits you need to qualify for disability benefits depend on age. When you became disabled, generally you need 40 credits, 20 of which are earned in the last 10 years. In the year in which you became disabled, for younger workers, less work, fewer credits are required. This is why you might have one neighbor that gets a Social Security amount and has different backgrounds than maybe a different family member, and all the different factors that can come into play in determining eligibility for these programs. You can apply for disability benefits in person, by telephone, by mail, or online, something I'll be talking about more. And the application is sent to a state office to make an evaluation for disability. After becoming eligible for disability benefits, the law requires us to conduct a medical review to ensure the beneficiary still qualifies for the program. This generally occurs 3 to 7 years, depending on the severity of the disability. So disability benefits are not for life. As a key function of the Social Security Administration, we do check back, determine whether or not the long-term disability still applies. May I have the next slide, please? If you are disabled but do not have enough credits to qualify for SSDI and have limited income and resources, you may be eligible for supplemental security income. SSI is a federal income supplement program funded by general tax revenue, not Social Security taxes. So SSI payments are not paid out of that 6.1 or 13.2% that each worker contributes into that FICA program. Social Security Administration administers the SSI program, which pays monthly benefits to adults with limited income and resources who are disabled, blind, or 65 years or older. Blind or disabled children may also get SSI, and we're going to talk about that. There's a whole specific section where I'm going to talk about how these benefits apply to children as we get later in the presentation. People who have worked long enough, recently enough, may be able to receive Social Security benefits such as disability or retirement and SSI benefits at the same time. And I'll explain, because SSI is an income-based program, you might have individuals that get benefits on the first, the third of the month, so on and so forth. Potentially checks from the state of Pennsylvania, which is called a state supplement. Additionally, any household with an individual who receives SSI may be eligible to receive discounted internet service through the Affordable Connectivity Program, or ACP. The ACP is run by the FCC, not the Social Security Administration. Always like to mention this because it is a relatively new program, but individuals that get benefits, supplemental security benefits from our programs automatically qualify for that program. Next slide, please. When you file an application for disability benefits with Social Security, we always check your eligibility for both programs. The same medical requirements apply to both programs, but the non-medical requirements differ. So SSDI work is going to determine how much you get in benefits. On SSDI, you might also have family members that are eligible for benefits. SSI is a federal needs-based program. For SSDI, you must have recent work history in order to receive benefits. Adults must have worked and earned Social Security credits 5 out of the 10 years prior to the onset of disability. For younger workers, however, less work is required. For example, below age 24, 1.5 years of work, or in a 3-year period before becoming disabled. Age 24 through 31, work during half the time between 21 and the time the disability began. And age 31 or older, work 5 out of the last 10 years. So once again, these programs are very specific, and that could affect why one person gets it and one person might not get it, or gets a different monthly benefit amount. Next slide, please. The definition of disability is similar for SSDI and SSI. What needs to be emphasized is the key difference for Social Security disability programs and other Social Security programs are for disabilities that will affect a person's ability to work for a long period of time. So the easiest way that I can explain, and sometimes what I will talk about more, maybe an ACL or a back injury, something that is measured in terms of month in recovery versus years of recovery, are also those distinctions on whether or not a person might receive Social Security or SSI, that disability that will prevent them working a year or longer. Next slide, please. In addition to meeting the definition of disability, you must have also worked long enough and recently enough under Social Security to qualify. And this is strictly for SSDI benefits. Next slide, please. Processing an application for disability benefits can take 3 to 5 months. The information we need includes Social Security number, potentially a birth certificate, names, addresses, and phone numbers of doctors, caseworkers, hospitals, clinics that took care of you. It's always very helpful throughout this process that you have dates of your visit, names and dosages of the medications that you have taken, medical records from your doctors, therapists, hospital, clinics, caseworkers that you might have in your possession. If you are applying for benefits, though, we do not encourage you to go to doctor's offices or go to these different places. When I talk more about the state agencies that make these determinations, they have many ways of requesting medical records via electronic channels so that there's not traffic going into doctors' offices and hospitals, very busy places that are caring for the sick. What we're asking for an individual who applies for benefits, we're looking for the roadmap. We're looking for the places in which the individual that's making the disability determination can find the information. Also, relevant items for the disability application process are laboratory or test results. And then, as we speak about SSDI, the recent work, a summary of where you worked and the kind of work you did. If you were self-employed throughout the process, we're going to want to see W-2 or 1099s. And then what I would recommend, if you know or if you are disabled, don't wait. Start the process. I'm going to recommend online here in just a moment. But the longer you wait, it can affect your potential eligibility. Whenever you first contact the Social Security Administration, we call that a data filing, and that can protect your eligibility since it does take a little bit of time to get a disability determination. Next slide, please. The quickest and most convenient way is online. The disability claims interview lasts about 1 hour. I'd say even a little bit longer than that, about an hour and a half. If you are deaf or hard of hearing, you may call our toll-free number at 1-800-325-0778. That's a little bit different than our other 1-800 number, between 8 a.m. and 7 p.m. Monday through Friday. If you schedule an appointment, we'll send you a disability starter kit to help you get ready for your disability claim interview. The disability starter kit is also available online at ssa.gov/disability. And what we'll talk about a little bit here is that the preparation for this interview or the preparation for applying for online, that's ultimately the most important part of the process, even with contact with Social Security employees. If you haven't gathered all the necessary information or provide all that information throughout the disability process, you might get a denial that might not be warranted. So thinking about things in advance, either scheduling the appointment or starting the process online, protecting your filing, but then taking that time to sit down and think about the doctors, hospitals, health agencies that you might have seen. It's very, very important to note that Social Security employees are still involved with the processing of internet claims. So basically, when you apply online for benefits, you're getting back the time that it might take to get that appointment. Our Social Security offices are very busy. It does vary from office to office, especially within the state of Pennsylvania. In some cases, you can get an appointment within a week or two. Pardon me. In other cases, it can take sometimes 30 to 45 days to get this type of appointment. So by applying online, by providing the information through an internet portal, you bypass that time to wait for the interview. However, you still get a live person within the Social Security Administration that evaluates your case. We'll follow up with you and we'll make sure that everything that is necessary for the claim is submitted. So by using SSA.gov to apply online, you don't bypass somebody, a live person, looking at your claim, compiling that claim for you. Next slide, please. An essential part of the disability application process is determining eligibility for both SSI and SSDI. And as I mentioned before, when you apply for disability benefits, that is that time period in which we're going over recent work, and also we're making the determination on whether or not you're going to apply for one of the programs, for both of the programs, and that is that screening process that starts at the beginning. Next slide, please. So there is that time period where the field office does have applications. They're the ones that are reviewing work information. In the cases of SSI, they're also the ones that are reviewing financial information. As it relates to making the determination that a person is disabled or not, each state has its own disability determination service we commonly call a DDS. They are separate from the Social Security Administration because the Social Security Administration wants that third party to make the decision on behalf of us. These disability determination services also sometimes get in contact with individuals. They are making determinations on your medical conditions. They're making determinations on when the medical condition may have started, and how the medical conditions limit your activities. They're the ones that are looking at the medical test results, the treatments you might have gotten. The state agency staff may need more medical information before they decide if you are disabled. If your medical sources cannot provide the information they need, the state agency may ask you to go for a special examination. We do prefer to ask our own doctors, but sometimes the exam will have to be done by someone else. Social Security will pay for the exam and some of the related travel costs. The conditions are based on information received at public outreach hearings, comments received from the Social Security and DDS communities, counsel, and medical and scientific experts. And these are what we call these are pre-screened medical determinations in which individuals might be immediately qualified for if we identify that you have those types of disability. There are more than 225 conditions that qualify for expedited disability claims processing through that type of program. Next slide, please. We do use this 5-step process to decide if you're disabled. Are you working? If you're working and your earnings average more than a certain amount each month, we generally won't consider you to be disabled. Another confusing part of these types of benefits in that a person can have a disability, but if they're demonstrating the ability to work at a certain level, then you're not eligible under Social Security rules. If you are working or your monthly earnings average to the current amount or less, the state agency then looks at your medical condition. So once again, that's a part of that screening process. And recent work is very, very essential to the process. That's going to be something that we're going to need a lot of information in regard to, and one way that you can prepare best for applying for benefits. Step 2, is your medical condition severe? For you to be considered to have a disability by Social Security definitions, your medical condition must significantly limit your ability to do basic work activities, such as lifting, standing, walking, sitting, and remembering for at least 12 months. If your medical condition isn't severe, we won't consider you to be disabled. If it is severe, we take the next 3 steps. Does your impairment meet a medically equal to our listing? So all the definitions that the Social Security is constantly evolving, constantly trying to improve. Our list of impairments can be found at SSA.gov under a section known as the Blue Book. This Blue Book does describe the medical conditions that we consider severe enough to prevent a person from completing what we call substantial gainful activity, regardless of age, education, or work experience. If your medical condition or combination of medical conditions isn't on this list, the state agency looks to see if your condition is as severe as a condition that is on the list. So somewhat complicated stuff that they kind of go into. If the severity of your medical condition meets or equals the severity of the listed impairments, the state agency will decide if you have a qualifying disability. If the severity of your condition doesn't meet or equal the severity level that's listed under the impairment, the state agency goes to step 4, and that is, can you do the work you did before? At this step, we decide if your medical impairment prevents you from performing any of your past work. If it doesn't, we'll decide you don't have a qualifying disability. If it does, we'll proceed to step 5. If you can't, and that being, can you do other types of work? If you can't do the work you did in the past, we look to see if there's other work you can do despite your impairments. We consider your age, education, past work experience, and any skills that you might have that could be used to do other work. If you can't do other work, we'll decide that you're disabled. If you can do other work, we'll decide that you do not have a qualifying disability. There are special rules for individuals that are blind. And from this standpoint, there are more informations. There are higher levels of what we call substantial activity as it relates to blindness. So that is a very, very special part of Social Security disability. And maybe some of the things that I discussed today might not apply to those types of individuals with blindness. Next slide, please. Okay, so what you're starting to probably pick up on is that this is a lengthy process. Social Security disability claims can take about 3 to 5 months to get decisions. But the Social Security Administration office that you were corresponding with, your local field office, will get in contact with you if your application is approved. During that time, you will then find out your monthly benefit and the effective date. Lots of things that take effect there. Your monthly benefit disability amount is based on your average lifetime of earnings. This is why different individuals get different disability amounts. There is a 6-month waiting period for individuals getting Social Security disability insurance, the program off of your working record. So that also enters into situations in which an individual can be eligible for SSI, for SSDI, and you know, I hope you're getting an appreciation for the complexity of the Social Security disability process, and you know why it does take a little bit longer for us to make these types of decisions. Next slide, please. Okay, I'll be talking about this a little bit more as it applies to children, but I did reference this previously. SSDI, once again, the working record. Spouses, other family members can be eligible for benefits off of this program. This does not affect the worker's monthly benefit amount. It comes off of a separate part known as the family maximum. If a spouse is age 62 or older, there are spousal benefits. There's also benefits for spouses of any age if they are caring for a child who is younger than 16 or disabled. An unmarried child, including an adopted child in some cases, stepchild, grandchild. In some cases, these children younger than age 18 still might have eligibility for off of a record of an individual that's getting Social Security disability insurance benefits. And then an unmarried child age 18 or older who has a disability that started before age 22, we call these disabled adult children, might also have potential eligibility off of these benefits. And as I had mentioned before, I'll talk as more specifically as this applies to children. Next slide, please. So we are transitioning right now. I was just kind of talking about SSDI, even though I did talk about SSI. These next couple slides are going to be talking about supplemental security income. The key differences between SSDI and SSI are financial. Individuals that are 65 or older do not need to be disabled to be eligible for SSI. Since SSI is a program that determines eligibility month to month, if you know an older person that has lost income, there might be situations in where SSI was denied, and due to changes financially, eligibility for SSI can take place. And those processes, those applications are much shorter than 3 to 5 months if an individual is age 65 years or older. We call these aged individuals. And in some cases, those types of applications can be scanned and awarded within 30 to 60 days. Next slide, please. SSI is known as a needs-based program, a program of last resort. It's also tied to Medicaid eligibility in the state of Pennsylvania. Common resources, as we look at the slide right here, any type of income does affect an individual's eligibility to get SSI. Wages, Social Security benefits, pensions, even money that family members are paying. Resources, common resources for people are multiple vehicles or homes that an individual does not live in. And then it's always important to note SSI is only paid to individuals that live here in the United States and the Northern Mariana Islands. If you're not a U.S. citizen, but you are lawfully residing in the United States, there is a chance of getting SSI. There are special rules connected to that, but permanent residents can potentially have eligibility for SSI. Next slide, please. One of the more little known parts of the SSI program is known as the living arrangement. Because it is a program of last resorts, because it is a needs-based program, SSI can even the monthly amount of SSI, even after somebody is approved for benefits, can be determined by if someone else, if this individual lives in someone else's household. A person that gets SSI but is in an institution otherwise only gets a specific amount of money per month. In some cases, it's $30. In some cases, it's more. And then the amount that an individual gets can be, can change based off of group care and board, or, what type of facility that they are in. Once again, another one of those common questions: why is person A getting a monthly amount off SSI and person B getting as you can see, and as I'll talk about a little bit more over the next couple of slides, there's so many different factors that can determine eligibility for SSI because it is that needs-based type of program. Next slide, please. As I indicated at the beginning, this next collection of slides is specifically kind of geared toward children. Children may be eligible as soon as they're born. One of the more common SSI claims are for what we call low birth weight babies, since they are hospitalized maybe sometimes for the first few months of their lives. They might be eligible for SSI. This type of benefit, as it applies for anybody that might be eligible for SSI, the most important part of that application might be that eligibility for Medicaid, in which SSI, an individual that is qualified for SSI, is automatically eligible for Medicaid. Much bigger deal many years ago, but still at this point, it's nice to have that consolidation of applications. When you deal with the Social Security office as it relates to SSI, the program, the Medicaid program, gets the information from SSI applications, so you only have to go to one place. And from that standpoint, as it relates to children, there are many different factors that can determine a child's eligibility for SSI, once again, from birth all the way to age 18. Next slide, please. A child with a visual impairment may be eligible based off of blindness if the impairment meets the definitions of blindness. Always important to note. That disability rules that apply to children are different than adults, and that comes into play with medical determinations that we have, or different times in which we make medical determinations for individuals. Schools and educational organizations are very important in the process of determining disability for children. And this is my experience. Previous to having this job, I worked in a Social Security field office for 12 years and had processed these types of applications. So as I was talking about getting prepped for a disability program or a disability application previous in my presentation, I'd like to expand, kind of that thinking as it relates to SSI. For children, much of the eligibility and the medical information can come from alternate sources other than adults, and should be thought about if you are applying on behalf of a child. Next slide, please. It's important to note, when I was talking about all the needs-based eligibility, the income, the resources, the living arrangement as it applies to adults, those same rules apply to children, but it's still very different. Once again, if you know that one person that might have been denied for SSI due to a financial situation, however, you have a child that's eligible, the income and resource levels are different in many different ways. How many parents are in the household? How many other children are in the household? So from that standpoint, if you maybe picked up on some of the income and resource limits from an adult standpoint, just to know and understand that doesn't always apply as far as the children is concerned. However, the financial elements of the program still apply to a child. Children's incomes sometimes are child support, Social Security auxiliary benefits, gifts. May I have the next slide, please? Deeming is this process in which parents' income and resources can affect the child's eligibility for benefits. This only applies to the parents within the household, and this only applies to children 18 years or younger. And we'll talk a little bit more about that. That age 18 age is very notable as it relates to SSI. Next slide, please. As I talked about before, the requirements for a child to be considered disabled according to our rules are different than the requirements for an adult. So any child that is turning age 18 and getting supplemental security income benefits, there will be a disability determination that takes place sometime within that first year after age 18. And this is sometimes an example of why a child might be getting SSI benefits, but then they turn age 18 and those disabilities don't apply as an adult, and that might be something that individuals come in contact with. Next slide, please. Very critical time, and what I'll say, just to kind of be simply to be simple as far as explaining these programs. I talked about age 18 is a very notable time. What I should have mentioned during that last slide, though, is that the shoe might be on the other foot. An individual, a child, might have been under the age of 18. They might have a disability that meets our rules. But due to the income and resources of the parents or adoptive parents that they might be living with, or maybe due to being within foster care, age 18 is notable in that the resources and the financial parts of the program change dramatically at age 18, because that is the point in which the income and resources of the parent, the adoptive parent, the income and resources, or the funding that comes from foster care, they change. So there are situations in which the person has the disability but aren't eligible, but now that they turned age 18, are potentially leaving foster care, might be changing custody. This might turn into a time in which a person is then eligible for these types of programs due to the financial portions as it relates to eligibility. Next slide, please. Individuals who apply for SSI under age 18 can still start the process online. However, it's not like an adult application where everything can be done online. If you do start online, you can protect the filing date in which you want to, the first time that you got in touch with our program, that can be the first point that we can pay retroactive benefits back to. That's one thing by going online. And there's also medical disability reports that can be filled out online, once again, in the comfort of your own home, at a time in which it's easier to gather information versus, being on an appointment. That can be done. And if you start any of these processes online, what will typically happen if you don't call the office more than likely will make an appointment for you. So if you do go online and state that you are interested in getting SSI benefits for a child, more times than not, maybe a week to 3 weeks later, you're going to get a letter back from that office that's scheduled an appointment for you, because from Social Security standpoint, anybody that starts an application with us, we will do our best to finish that application, those protected filing dates, and making sure that all applications have a decision. Next slide, please. Much like with Social Security disability, a child will come into the field office. Instead of work being the big thing that we're evaluating for an adult, for children, we're looking at a lot of those financial elements, the financial elements of those individuals that we call deemers. And if we find that person has the financial eligibility for this program, it's sent off to that state disability office, much like the adults were, and much what I was saying about that disability office also applies. You're looking to give the roadmap in situations in which not enough medical information was provided. You might potentially go to a Social Security doctor to be evaluated. These same things still apply to children. Much like the adult applications, these applications can also take quite a bit of a period of time, 3 to 5 months. But it's important to note that retroactivity comes into play with all the different programs. Next slide, please. As you can see, there are lots of situations in which SSI can be affected. So reporting responsibilities are very important. I'm going to talk a little bit about the representative payee process at the end of this this presentation. But if you have a child and they have this person known as representative payee, there's lots of education that needs to take place. If you are involved with the SSI program, there is so much that can be reported because there's so much that can affect. We already talked about income for an individual. We already talked about where the individual lives, money they might have access to. It's for all those reasons that there are just so many different reasons that there would be reporting responsibilities to the SSI program. As I mentioned before, SSI is a month-to-month program. From the standpoint of there can be eligibility for 1 month from a financial standpoint, and then not have eligibility in other months depending on income and resources. Next slide, please. And here you have these lists of all the different scenarios that can affect SSI eligibility. Just throwing that out there, especially if you know anybody that gets this type of program, encouraging them to have as much contact as possible with the Social Security office. Next slide, please. Now, I am transitioning a little bit. This is not supplemental security income anymore, and since this cluster right now has to do with children are also eligible for survivor benefits. So basically, survivor benefits obviously aren't disability benefits at all. Survivor benefits are a way in which family members can collect from a deceased member's working record. As far as children are concerned, if they're not married and they are under the age of 18 or between the ages of 18 and 19 and a full-time student in high school, they can have eligibility. We call that secondary school, but they can have eligibility to survivor benefits, that being benefits off of a deceased parent's records. A disabled child may also receive benefits beyond age 18 if he or she is not married and the disability took place prior to age 22. This is in some ways why somebody might be getting benefits as a child, or in this case, they'll be getting benefits as an adult, but have the ability of collecting benefits from another working record. The design there being they hadn't had an opportunity in their life to create a working record. If an individual is getting benefits off of a survivor record, the needs-based portion that was associated with SSI is not associated with these types of benefits. So survivor benefits in many ways can be disability benefits for an individual beyond age 18, but then not have those financial elements that determine eligibility. So you once again might have a 25-year-old who's getting benefits because they're disabled off of a parent's record, and then the same 25-year-old might be getting benefits off of an SSI record. That person getting benefits off of an SSI record is going to have more aspects that determine eligibility than the person that's getting benefits off of a survivor record. This slide goes into widowers and divorced widows. And I do quickly like to point to this, even though it's a little bit outside the scope of what we're talking about right now. But eligibility for these programs can start at age 50 if an individual is widowed and they are disabled. So these are lesser known benefits for individuals, and if you know anybody in that situation where they have had a spouse that had passed away, there might be eligibility that a person might not be aware of. Next slide, please. Once again, we're talking about an individual who's getting benefits off of the SSDI program. Auxiliary benefit for children off of this program, once again, do not have those rules that take place with SSI. But there are certain children that can have eligibility for parents that are disabled. So they're getting benefits off of SSDI, and their children can then receive benefits because they're no longer able to work. They need to be, many of the same rules are very similar: unmarried, younger than age 18, 18 and 19 if they're still in high school, or 18 or older. So the auxiliary benefits are different because the parent still might be with us. getting Social Security disability benefits, and all the kind of explanation I was giving you in the last slide still kind of apply here. Why you might have one 25-year-old who gets some different monthly benefit amount, and where they live doesn't affect the monthly amount, versus a person that's getting SSI benefits, having all those types of situations. Next slide, please. Always like to touch upon the differences between Medicare and Medicaid. Medicare is the federal program. Important to note, individuals who get SSDI, that is the disability program off of the working record, get Medicare 2 years after eligibility. An individual who gets SSI has automatic eligibility for Medicaid. So from that standpoint, I had spoke about that on a previous occasion, but there's lots of differences, and people sometimes use these terms interchangeably. Next slide, please. As I had mentioned before, I wanted to mention the representative payee program. This program is for individuals who cannot manage benefits. In the case of children, minor children, wouldn't be asked to manage benefits or manage the program as complicated as the SSI program. From this standpoint, representative payees basically are the individual that receives money on behalf of another individual and uses that money on behalf of the individual. And in that way, they basically have the responsibility of the benefits being paid by the federal government. And in so doing, have, different, types of responsibilities. As it relates to SSI, they have the reporting responsibilities. And each Social Security field office will make a determination. As I was talking about children earlier in the presentation, an individual who might have a child living with them, and they had not yet adopted that child, their income and resources might not affect that child's eligibility for benefits. However, they might still serve as a representative payee for that child. And in so doing, the income and resources of them do not affect the eligibility for the child or even the individual, the adult individual that they might be working on behalf of. The representative payee program also comes into play for individuals later in life that might have dementia or Alzheimer's. So it's very important to note, this is a terminology basically only used by the Social Security Administration, kind of like power of attorney from a legal perspective, although we don't recognize power of attorney. This is why we have this program. So it's important to note, and I wanted to kind of mention this as we kind of finish up the presentation. Next slide, please. The other subject matter I wanted to touch upon as I finish everything up today, there is a new program known as Achieving a Better Life Experience that I like to talk to as much as possible. These types of programs can basically take resources and put them in a place in which they can be used for specific purposes. However, it does not affect an individual's eligibility for SSI or even Medicaid, because Medicaid can be awarded by the state without SSI involvement. But I like to kind of sing from the mountaintop ABLE accounts and how good they are, especially when you're in this realm right now. The resource limits for an adult who's getting SSI is $2,000. That amount has not been changed for quite some time. So programs like this can really help with people having money set aside for situations that can happen within their lives, and still be eligible for benefits. Next slide, please. As you can see, up to $100,000 can be set aside for somebody. And, the money in ABLE accounts can be used towards housing, education, healthcare, transportation, everything that you see on the list here. And it's a very large part of navigating this process, whether it be SSI, Medicaid, or the different programs that you can come in contact when you do get encounter disability programs. And then finally, the next slide. Pennsylvania is a state that does offer ABLE accounts. If you're, on the call today, if you're getting SSI or have a child that's getting SSI, I can't recommend ABLE accounts enough. They interact with Social Security systems very well, and from that standpoint, they are kind of a lifeline nowadays when you have these needs-based programs. And finally, one last slide here. There's going to be tons of changes that take place the rest of this year. You might be following the headlines right now. Different cost of living amounts, different amounts for Medicare Part B, different eligibility requirements as it relates to what we call Part D subsidies for prescription drugs. Due to all this, throughout the rest of this year, I do highly encourage you to follow the Social Security Administration on social media, because there's going to be lots and lots of news that comes out between now and the end of the year. And at this time, I'm sticking around. There's going to be some more presentations that are taking place right now, but I'll be available for a Q&A after the next section of the presentation.
Alrighty, thank you, Frank, for all that important information. All right, so Mackenzie, you want to go to the next few slides? Keep going. And there you go. I'm now going to provide an overview of how Senator Casey's office may be of assistance to constituents regarding Social Security issues and navigating federal agencies. So Senator Casey's Office of Constituent Services consists of a team of constituent advocates who assist constituents who are experiencing issues with the federal agency. This can include, but is not limited to, Social Security benefits, missing passports, IRS problems, VA benefits, immigration snags, SBA concerns, and more. After our office has received your written permission, our office is able to follow up with the federal agency on a constituent's behalf to check on the status of pending claims or appeals, ask a question, relay information and concerns, and demonstrate Senator Casey's interest in a matter. Under the law and rules of the U.S. Senate, we cannot force a federal agency to act in someone's favor. It's also important to note that if we cannot provide assistance, such as with a state or a private entity, we can refer constituents to someone who can best help. Next slide, please. Alrighty, with regards to Social Security disability, we can assist constituents who have questions regarding their appeal status, back pay, or overpayments. Overpayments can be caused by your marital status or living situation changes. Your income is more than you estimated, you're no longer disabled and continue to receive benefits, or you don't report a change in your status to Social Security as required. We can also assist with questions regarding SSI, such as appeal status or income, and assess limit questions. Our office can also help with Medicare Parts A and B enrollment issues. Next slide. Alrighty, if you would like to request assistance from Senator Casey's Office of Constituent Services, either with a Social Security question or for an issue with another federal agency, please do not hesitate to reach out to our office at 717-231-7540 or toll free at 866-461-9159. You can also reach out to Senator Casey's office via his website, which is www.casey.senate.gov. And we will now open this portion of the presentation for questions for Social Security or Senator Casey's office. If you have a question, you can click the raise hand button at the bottom of the participants list to indicate that you have a question. I will call on participants that have questions one by one and unmute you. Please note that this is a public call, so we ask that you please keep your questions general. If you have a specific issue, please feel free to contact us via the information on our screen. Alrighty, so Carolyn, I have unmuted you, so go ahead and ask your question.
I'm Carolyn Mosley, and I have a question. I'm currently receiving Social Security disability, and I lost my handbook. How can I get that replaced?
The handbook is specific to Well, I would recommend SSA.gov, but there are different handbooks as it relates to Medicare or in some cases working. If you're more specific, I could give you a specific web address.
Okay. All I know is when I received or was approved, they sent me a handbook, for Social Security Disability, SSDI.
Mhm.
And I can't seem to find it, but my specific question relates to, I guess, what are the new income limits? Like, say, if you
Mhm.
earn additional income, what are the new income limits? And I know that there was an exclusion in there regarding consultants. I need more information on that. So I just thought I would start with the handbook and then,
Yeah,
you know, and then, sort of navigate from there.
that is known as the Red Book. And you can find that very easily by going to SSA.gov. And in the top right hand corner, pardon me, there is a search box, and you can put Red Book. And
Okay.
that was a fantastic question, by the way, because as I was kind of indicating before, there are changes that take place from year to year. That cost of living increase that applies to people's monthly benefit amount. So you getting Social Security disability stand to have a raise due to that cost of living increase. And I know you've probably lived through this before, but from the standpoint that whenever there is a change to your monthly benefit amount, there's also changes to those other amounts, which you astutely kind of pointed out. The one being a substantial gainful activity. For 2022, that amount is $1,350 per month. That is for 2022. So if anybody's looking at this video at a later time, that's probably going to change, and it's going to change. If you do get that larger COLA that many of the media is calling for right now, you'll see an appropriate amount of increase as far as that's concerned. It also has to do with what we call trial work period months in which an individual is they're basically count as months in which they can work and earn as much money as they like. In 2022, that amount is $970 per month. Whenever I mention these amounts, these are gross amounts, and that 970 will increase in 2023 based off of upcoming cost of living increases. But in relationship to yourself, two things you would have got when you started getting benefits was that notice of award, something that we can always replace. And in some cases, you have to present to different agencies later on. And then that Red Book in which you had gotten do list everything as we're talking about it relates to working.
Thank you.
All right, thank you for that question, Carolyn. All right, so next I have Melissa. Melissa, you are unmuted.
Hello.
Hello.
Hi. So this is I'm not quite sure what to do. My husband had a stroke, but he was also about to retire in another like 6 weeks after the stroke. So that he was due to retire November 1st, but the stroke beat him to it. So I'm not sure what I should be applying for or what you would do in a situation where you actually, have two different things going on.
How old is your husband, ma'am?
He will be 62 in October. And he
Okay.
was applying for early retirement at 62
Mhm.
because of the effects of the first stroke. This is
Well,
his second one now.
I'm very, very sorry to hear that. And I know you're probably going through quite a difficult time. What I would recommend is applying online. If you're not comfortable with that, contacting your local field office. The best way to find field office numbers are either through our website, socialsecurity.gov /office locator, or one good way is through Google. Don't click the call function because that'll send you to our national 1-800 number. But the secondary numbers on Google will give you the field office phone number. At this point, I would highly recommend that he apply for disability benefits. You can assist him with this process. Either you can indicate that you're assisting him online, or you can get on to the appointment and help the technician on the call with you. And what will happen, ma'am, is if he is eligible for disability, which at age 62, an individual can still be eligible for Social Security disability benefits. But if he's eligible, what he'll get is his monthly benefit amount had he waited until age 67, which would be his full retirement age. So the distinction there is that, unfortunately, your family is going through the great challenges right now. However, the Social Security Act kind of acknowledges that this isn't an early retirement situation. This could potentially be Social Security disability, and in so doing, he could get a higher monthly benefit amount than he would have got as a retirement benefit at age 62.
Okay. So my best bet is to contact the field office, and because he can't drive, his left arm is kind of useless. His left hand is definitely useless.
Mm-hmm. Well, due to the pandemic, we have been encouraging phone appointments as much as possible. I know that can kind of feel, for some people, they expect to have the service done in the field office, but you're still talking to a technician, and the Social Security offices now exist in a hybrid environment, so it makes it easier for scheduling. But as I advise you right now, the first step really does start with gathering all that medical contact information, names, addresses, phone numbers, dates in which he'd seen specific doctors, hospital, health agencies, starting to gather that information, building that roadmap, that analogy I was using before, and doing what you would be most comfortable with. I was trying to kind of talk about the benefits of applying online. If after that process of gathering all the medical information, gathering all the work information together, by doing so online, you eliminate that waiting period that you would potentially have waiting for that appointment, which, like I said, in the state of Pennsylvania, averages around 30 days. And basically what you're doing is you're providing all that information via that online portal, versus basically verbally telling somebody that information throughout an interview. But in both cases, a Social Security employee, a live person from the agency, compiles that claim together, does that screening work that we talked about during my presentation, and makes the determination on whether it goes off to the Disability Determination Service. In the case of your husband, there can be what we call retirement/disability. We call it RIB-DIB. He can start collecting his retirement benefits while he waits for his Social Security disability decision, gets that lower amount, and if he's approved, then everything is just increased due to the disability determination. So that's also something that takes place if you do apply via the field office.
Okay. I'm sorry, where did you say to get that? Find out my closest field office and get a phone number, or who should I be contacting to make a phone appointment?
You could start at our website, ssa.gov. In the top right hand where there is that search bar, type in office locator. Social Security offices are kind of your assignment to specific Social Security offices don't go by county lines. By using that office locator, the next step after you get onto that office locator page, you type in your zip codes. That's how we make a distinction. That's how we make the determination of which is your office of responsibility. And it's important to note that if you just immediately go to Google, click the call function, you might go to our national 1-800 number, which is good for scheduling appointments, but interacting with the specific field office is most beneficial, especially as you kind of navigate that 3 to 5 month process of getting the disability determination. But in your case, due to what we call the RIB-DIB element of this, I would encourage you to contact your local field office.
Fortunately, it's not in the greatest area, but okay.
Mm-hmm.
Yeah, Melissa, I'll just jump in here. If you have any issues contacting your local field office, you can always give our office, Senator Casey's office, a call, and we can help you out as well.
Thank you so much. I appreciate it.
Yeah, you're welcome. Thank you for that question, Melissa. Alrighty, so I see Carolyn has another question, so I will unmute her. Okay, you are now unmuted, Carolyn.
Okay, thank you. You know, I tend to watch the news a lot, CNN, and I know that there's some discussion about changes in Social Security that's currently taking place on Capitol Hill. Can you give us any insight, or if you have any information about how Social Security disability or Social Security income might be affected by some of these proposed changes?
In general, because of my role with the agency, I don't kind of speculate or even kind of go off of from a political standpoint of what can potentially happen. But whenever I do get this question, and this is a very common question, what I do refer back to is the last time that the Social Security benefits were reformed. It was back in the 1980s, and Ronald Reagan was the president at that point. It's important to note when that reform took place, which basically at that time there was what we call a windfall elimination provision instituted. That was for people that had paid into non-Social Security employers. The other thing is what's happening right now is that the full retirement age had been gradually increased from age 66 to age 67. So, for example, right now there is that process taking place in which, if a person is born age 50, if you were born in age in year 55, if you were born in 1955, I'm so sorry, your full retirement age is 66 and 2 months, all the way up to 1960 and later. Basically, the point I'm trying to make is that what you see as far as potential changes to the Social Security program and potential changes that will keep the trust funds vital and keep full benefits, these are probably going to be changes that are made for future generations so that future generations can, make the necessary plans so that it's not something or a hardship that is imposed upon an individual like yourself that is used to the amount of benefits that you're currently getting. And as I kind of mentioned before, this is a very, very political subject. And, from that standpoint, back to my point without, kind of editorializing it, it's something I shouldn't be doing for a person in my position.
Sure.
What I would say, any changes would not affect the individuals that are currently getting benefits. Those changes would be, made for future generations, so that the trust fund, remains paying at 100%.
Thank you.
All right, thanks for that question, Carolyn. Alrighty, not seeing any other questions. I'll just give it a minute for if someone does have a question and they'd like to raise their hand. Alrighty, well, thank you everyone for joining us today. Oh, I see we do have a hand raised. So Cameron, I have unmuted you. Go ahead and ask your question.
You hear me?
Yep, we can hear you.
I was just asking, is there a possible way that you could send us the presentations?
Sure. So we will, this was recorded, so it will be posted on Senator Casey's YouTube page. So you'll be able to see and hear everything that was talked about today on that YouTube page. If you'd like, you can give our office a call and I can take down your email and I can send you that link once it becomes available.
Perfect. Thank you.
Yeah, you're
That was all.
welcome. Thank you. Alrighty, not seeing any other questions. I thank you all for taking the time out of your day to join us and learn about Social Security disability. I hope you all have a wonderful rest of your day.
Take care, everybody. It was a pleasure.